So welcome everybody to this month's UEFA medical webinar. An exciting topic today, I might say. We're talking about mental health, and we got two expert speakers who I will introduce in a second. We're going to do a bit more interactivity today, and so we really need all your input. We need your questions, and we need your active collaboration today. I will explain in a second how and why. But before we do so, I would like to introduce our speakers of today. So first up is Nádia Tavares from the Portuguese Football Association, sports psychologist. Welcome, Nádia. Really glad you can join us tonight and share your expertise and thoughts on the topic.
Yeah, thank you very much. I'm very happy to be here to bring some ideas about mental health.
Wonderful. And our other speaker today is Vincent Gouttebarge. Hello, Vincent. Vincent is an extraordinary professor in sports medicine at the University of Pretoria in South Africa, a researcher in Amsterdam University Medical Center, but also the chief medical officer at FIFPro. So a few hats there, but also a great expert in when it concerns mental health and with a specific interest in football. Welcome, Vincent.
Thank you for the kind introduction and the invitation to have 1 hour to speak about an important topic.
Wonderful. And maybe for a few words, I'd like to also introduce Zoran Bakhtiarovic tonight, the Chief Medical Officer of UEFA. Welcome, Zoran. Glad you could make it today as well. Maybe you'd like to
welcome Everett. Thank you, Everett. You're getting better and better in pronouncing my last name. We're going to make a proper Croatian out of you when you join UEFA. Good evening to everybody. Thank you to our great speakers. I'm looking forward very much. I'm excited about tonight's topic because it's really important. We need to think about football players as human beings. We very often talk about their performance, about their efficacy, about how fast they are running. We forget that we are talking about load now. We are talking about number of things now, but we should not forget us as medical practitioners that they are human beings. I'm also thrilled that presence of Vincent here from FIFPro shows UEFA's and FIFPro's determination to work together in improving health status of all the players. And having said that, one of the big events that we are having next year in a little bit less than 3 months, almost like in 2 months, is 9th UEFA Medical Symposium. It's from 4th to 6th February in Lugano. The motto is the women's game and beyond, but it's going to be about the overall topics of overall health for everybody involved in football. So it's not only about women. For the first time, we are opening medical symposium to accept to the doctors also of the national teams, to the doctors of all the clubs, but also to the physiotherapists, because one thing which we all very often forget is that physiotherapists are more often than not the points of contact, first person that players are talking to, the only person that is spending 24 hours with the team, and we need to involve them in our medical education and cooperation. Having said that, I'm not stealing a second more from the great topic today. Thank you and enjoy, everybody.
Thank you, Zoran, for those introductory words. Nádia, I'll give the floor to you for a second. You prepared a little exercise for us to start a discussion and to start a further deliberation on the topic. Can you please introduce what you expect from us?
Yes, as we are talking about mental health and sharing some ideas about it, maybe I would like to ask the viewers to also answer what they think mental health is. So I prepared a QR code that I think you can see it already.
Yes, it's on the screen. The link to this Padlet is also in the comments box. So if the QR code doesn't work for any of the attendees, the link is in the comments.
Yes, so just what do you think mental health is? What do you think about when you think about mental health? Sometimes we have a wrong idea about mental health. For example, sometimes when we think about mental health, we immediately think about a disease, a pathology, and the bad side of mental health. And mental health is not just the bad side or the dark side. So I really would like to hear your ideas about what you think mental health is. I think someone is already writing. I don't know if my teammates today want to answer it too, so we can have a variety of ideas. I think it's good to know where we are at on our ideas of mental health. So our chat could be more personal, if we know how people are thinking about mental health today. Maybe it's easier for us to answer some questions that go to your reality and not just ours. Sometimes, as specialists, we talk a language that people don't understand, and we are trying to go to meet people at their understanding of mental health today. So I don't know if anyone already answered.
Let's give them 1 or 2 minutes, Nádia. And
Yeah.
while people are typing what they feel mental health is, Vincent, may I ask you at your work at FIFPO, what does mental health mean for you in your work? How do you approach it? Where you're focusing on?
Obviously, we are at FIFPro representing players so that they can perform optimally in their sport, and you need different skills. Among which mental health skills as well. From a medical perspective, obviously, we also have attention to various health domain. Musculoskeletal injury is obviously one of the most relevant one during a career, but mental health challenges, as I call them, is also a medical topics that we are working on, not only because our active players are reporting those mental health challenges, but also because our retired players are mentioning, the struggles that they have when they retired from their career. So mental health for us is, a little bit as Nádia is going to explain, it's that spectrum from an extreme positive side, which is synonym of being resilient and performing quite well, to the extreme negative side, which is synonym of mental health symptoms and in worst case, mental health disorders.
Thank you, Vincent. Retired players is an interesting topic I flagged down here. Let's get back to that one later. So thanks for mentioning that. Nádia, do we have some answers already?
We do have some answers right here. We have balance, awareness, focus, performance enhancement, yes, overall well-being, global health, and the statue of health of the mind. The homeostasis of mental health could be 5-10 with depression and election either side of the scale spectrum. Yes, balance, mental health, well-being. So we have some constants on this.
Some quite broad definitions there, isn't it? If I eyeball that. Okay.
Yeah, balance is really important, but also interesting that someone answered to enhance performance. Because health and performance, I cannot separate those two. They're really similar when we talk about skills and behavior. There are some things we cannot do or without health and on our performance, right? So maybe I'll just, if someone wants to answer in the comments, maybe I'll just stop sharing this one.
Yes, and we can get back to this later. And if anyone has any questions or further comments, do not hesitate to put them in the comments box below or the live stream, and we'll put them into our chat. But I believe you have a slide with some explanation prepared.
Yes, I would like to share this slide with all of you. Sometimes we think about mental health as I have it, I don't have it, like health and disease or health and pathology. And mental health actually is a spectrum. We have a lot of stages, 5 stages of mental health, of mental well-being. that also have a part on our performance, on our ability to be ready to perform, to deliver a result, a behavior, a skill, a task. So when we see this spectrum, we really change our way of seeing, of thinking about mental health. Because if you think about it, if you think about these stages, you don't have to memorize everything, but just know the context, know the idea behind this continuum. Because if you think about it, if you think about these stages, maybe sometimes you wake up in one of the stages and you go to bed at night in another stage. On the same day, you can change the spectrum. On the same hour, you can change the spectrum. For example, if I'm talking with a coach, maybe he woke up really motivated to practice. He was feeling capable of giving practice, and then practice doesn't go as he was expecting. For example, or he has a conflict with one of the players or one of the coaches, he can change the spectrum on his continuum of mental health just because something went wrong. Sometimes you can have a bad night of sleep. You can be like struggling or in crisis in the matter of sleep, but that doesn't mean that you have a pathology. That just means that you change a little bit on your spectrum. Or sometimes something is giving you some anxiety. You can change your appetite, or you can change your normal mood, or you can change the way you deal with people because you are stressed or thinking about something too much, or you're inside your head a lot. You can change just because of something happened. I think the thing to really have some concerns is the time that you spend on one of the spectrums and the intensity of the symptoms. Because if one day you're anxious, or one day you have a conflict, or one day you're not sleeping like you should, that doesn't mean that you have a pathology. Just mean that you have something happen in your life that changed your emotional status, or your way of thinking, or you're a little anxious, or you don't feel as capable to resolve things as you used to because something happened. So you really have to pay attention to your self-knowledge and your self-conscience. Okay? Self-knowledge is you have to be aware of your patterns. I know that I sleep this time and I wake up at this time. If that changes, maybe something happened. I know that I eat like this. I know that I behave like this with people. I know that I smile too much, or that I'm easy going, or that I like to be with people. Or if I know my patterns, I know when I'm changing them. If I don't have any self-knowledge, it's really easy to just be aware of myself when I'm in crisis, because it's an extreme. But if you have self-knowledge, if you're aware of yourself, you can be aware when something changes a little bit, and you don't have to go into crisis to change. And more, I think the really highest of levels is to anticipate moments that you know that you're going to have a lot of work, or a stressful time, or you're going to go on a travel, or you have a presentation or something, and you anticipate that, and you already do some strategies to anticipate being struggling or unsettled or in crisis. So self-knowledge and self-awareness, it's really important for us to know where we're at, and to look at mental health as something that maybe you're in the middle, or you even thriving. You can be always better. And that's one of the things that we always talk about with athletes. If health and performance are not separated, and maybe if you're thriving, you can be excelling, maybe you need to work on your skills, on your mental skills, always. Even if you're okay, you can always be better. I say this a lot to athletes. Look, you have a six-pack, don't you? Yes, I do, but you still go to the gym, right? Yes, so you can have a six pack on your mental well being or whatever, but you always can work more. You can always be better. And the better you are, the less chance you have to be in crisis. Or the better you are, even if you go to crisis, you can recover quickly. So this is like the main idea of mental health. It's more dynamic than I have it and I don't. It's like the physical health. You don't have to have a disease to improve your health. You can always be better in your health. Mental health, it's kind of the same.
Thank you, Nadia. A really quick question. You just said you need to work on it to become better, but do you really need to become better if you're already at a really nice state? Do you need to work on it to stay at that state? What does it always need to be an improvement?
Yeah, it can be both. I think there are things that we can always be improving, even if it is a perception. Because I think that sometimes you are the same, but you become more demanding of yourself. Maybe you went up a level on a league, for example. Portuguese players that go from the first league in Portugal and go to the Premier League, they feel that they went up a level. So sometimes they're the same, but their demandings, their self demandings are bigger. So they now want to improve on some things. But I think that your question is really good, because sometimes we put some expectations and we are really hard on ourselves and pressure ourselves to always be on some hypothetical potential. And sometimes it's good to always have the mentality of maintaining. But I think the mentality of improving, it's not bad if you know how to separate your skills from your identity.
Fully
Okay.
understood. Fully understood. A question at you, Vincent, and more from your experience of working with athletes and talking with athletes, also on this model. If I look at myself, maybe in one day I go from crisis to excellent, and it's not a steady state at a micro level. But if you talk with players and you hear their stories, when do these changes in this continuum become really problematic? What are the red flags in your experience?
Well,
I think
obviously,
our two main. It's for me.
Oh no, it was for Vincent.
Oh,
Sorry.
sorry.
And then I'll give it back to you, Nadia.
obviously, from my position, I'm focusing on the extreme negative side, synonym from self-reported mental health symptoms or clinically diagnosed mental health disorder. And well, there are many contributing factors that are likely to play a role in the occurrence of mental health symptoms and disorders. And we make the distinction between generic contributing factors that are available for the general population. Generally, you have to think about adverse life event that might occur, a family member might have passed away, or financial pressure as well. But the most relevant one in the context of professional football is obviously the sport-specific contributing factor. And one key contributing factor is a severe injury that leads to a long-term period without training, without competition. It is quite challenging to cope with and to be resilient when you are exposed to weeks or months, in worst case, without football. So definitely it shifts, as mentioned by Nadia, day to day, but those big mental health symptoms and disorder are definitely triggered by those adverse life events. And coming back perhaps on that spectrum, obviously, I think it's good for the medical practitioner who are online to know that we believe that on the extreme positive side, it's the area where the sport psychologists work, towards performance. And the extreme negative side, you definitely need to have a clinical psychologist or sport psychiatrist within your multidisciplinary team so that the player have a holistic medical support.
A quick follow-up question on that, Vincent. Do you recommend teams to have such a position within the team or someone who is linked to the team? Because I can assume that or imagine that not all teams have the resources to arrange for that.
Well, and there is a resources problem for sure. And most of the club, even in professional football, you know, in top leagues in particular countries, they don't have the resources. They prefer to put their money on a third or fourth right back, you know, in their selection. So there is a resources problem, but there is also a confidentiality problem because a lot of players tend to be reluctant to speak about their mental health challenge with a mental health professional in the club because he or she might refer this information to the coaching staff. So there is also some confidentiality to take into account, and it's why we don't have a particular strict position about that. It's all about what the player is feeling comfortable with. It could be someone external, and it's why you need to have a network, a referral network with a mental health professional outside of your club so that the player can lean on, but it could be also someone who is embedded within the performance and medical team. So I don't think there is one size fits all, but confidentiality with mental health is always something that come back to us.
Got it. Thank you. Nádia, back to you. Vincent just mentioned a few of the stresses that make the life of a football player unique that general society doesn't have. Are there any parallels or major differences to be looked at?
Yes and no. Yes, because they are all people. I think there are some science that we have to look at when we talk about mental health and consider all people, okay? Because we don't have only factors based on context. We have factors based on genes, on family, on events when you're a child, in a childhood. So not just context. And then I said yes and no because we have context that is really different from the majority of people being on a high performance environment as football is really mediatic. We have a lot of stability linked to our performance. We have a lot of identity linked to our performance. So we have a lot of factors in football, in high-performance football, or professional footballers, that really can enhance the mental health declines that maybe can happen on the life of a footballer. But also there are good things of being an high-performance athlete. You develop a lot of skills that you don't really have to think about them. You just develop them because the challenges that football have and high performance have, you develop some skills, but you are also exposed to some factors that can decline your mental health. So it's a two-way street, and sometimes what defines it's your own skills to deal with life. I would say that that's the most important thing when we're talking about mental health. It's the skill training. You being prepared to be resilient, to manage your emotions, to think about yourself, to have self-conscious, to have good self-confidence, self-esteem. So train your skills to be ready for life events inside and outside of football and professional sports in general, I think.
It's a bit of a mixed bag. So
yeah.
Good to know. We have one question. I may throw this one at you, Vincent, also because of your involvement with FIFPro, and I know you're doing some work on mental health and prevention of adverse mental health from the IOC. There's this question about more preventive approaches. Could you give some examples of how you can, in the football context, work more proactively to detect issues and interventions?
Well, as mentioned by Nádia, it all starts with being self-reflective. So you need to raise self-awareness about own feelings and how to deal with it. And, if you want to be resilient, you need to have a degree of self-reflection and rationality as well. So there is definitely what we call mental health literacy, which is very important for treatment of any mental health symptoms and disorders. So it's educational part. You can achieve that in different way, but you can achieve that as well if you linked that with a screening program. For instance, in professional football industry and other sport, we are screening our athlete before a season for any cardiovascular abnormality or for injury or orthopedic problems. But in elite sport, we don't have a lot of tools in order to screen our athlete for mental health symptoms and disorders. And it's true that the International Olympic Committee developed those kind of screening tools a couple of years ago. And if you screen your athlete, obviously that makes them self-aware about the importance of mental health. That might also trigger the self-reflection as well. So it's kind of win-win situation in order to identify in early stage athlete potentially at risk to experience mental health symptoms and disorders. It helps to increase awareness, decrease the stigma as well that is still present around mental health, especially in the context of professional football. So there are a couple of preventive avenues that definitely can be implemented in practice.
Perfect, wonderful. And I believe the IOC resources are freely available also with the mental health assessment tool. Are you okay we share that with
Yes, of course. You know, the IOC at the Athlete 365 website where all resources are available. And I must say that the IOC was one of the first organizations that focused on mental health, together with FIFPro and the Amsterdam UMC as well, under the lead of Gino Kerkhoff, I must say, in 2013. And now we have a lot of resources available, not only for athletes, but all members of the athlete entourage that include coach and the medical staff as well.
Wonderful. Thank you for that answer. Nádia, one of the answers Vincent gave was on education. Now one of the very important times for a professional player is when they transition from the more junior levels to the first teams. I can imagine there's a lot coming at them. How can you ensure that from the mental health aspect that transition is smooth? Are there any tips and tricks?
Yeah, I think prevention, it's not a very attractive word, but I think we really have to work on prevention. So we have to prepare the players. When we are working with young players, if we expect them to reach a high level, that we do when we work with them, we have to work also the mental side of it. So
can you give some examples of how you can do that, how you can work with them on that?
Yeah, I can give a practical example. When I work with an academy, youth football, we talk with the coordinators, with the technical coordinators that were planning the development of the players, the technical and tactical side. And we tried to make a parallel of the mental side also. So if we are on the stage of the player that he has to learn how to practice, learn discipline in practice, we have to talk about authority, relationships, teamwork, concentration, focus. If we are talking about winning, competing, or the pleasure of the game, we have different mental skills that we have to work with the players. So if you are working with B teams and with transitioning teams like under 23, the B team of a club, and we are preparing them for competition on the technical and tactical, and even in the competition that they are in, we also have to prepare them mentally to those challenges. I think if we make it gradually, it's easier. Sometimes you don't have that chance. Sometimes a player can be called up for the A team from one day to another. And I think the answer for that is prevention. If we don't have access to that, maybe not putting so much pressure on a first result on the first game, on the first appearance is really important to give some confidence. The relationship between the coach and the player is really important. The environment of the players on the team is really important. Not putting a lot of pressure on the performance on the first game. Maybe being aware that if the player has a good link with the family, has a good relationship with his social environment, have someone to support them outside of the football context. For example, we have a set of stuff that we have to be aware of, but I think that I have to go to prevention. I know that sometimes we don't have resources, but I think that we have to give the answer that we think it's the most effective anyway. And I think it's working first and then giving into the lions, as we say.
That sounds okay. Vincent, back to you, because on the other hand of the spectrum, we have the retiring player. At the end of their career, they need to transition to a different life, so to say. I know FIFPro is adamant on supporting these players. What can you say about what we need to know at that stage to support these players as good as can be?
Well, I mean, obviously, you have to have the basic knowledge of the health challenges that might occur at the end of a career and while transitioning out of professional football. It's not only the mental health problem that are at the forefront, but there is obviously a quite challenging dynamic of health issue and identity problems that might occur. But when it comes to the mental health spectrum, obviously, anxiety, depression, sleep problem is something that is often reported among a retired player. And because of that, a couple of years ago, we did develop what we call the after football career consultation, which is, well, a health exam, actually a medical examination from a holistic perspective with a strong focus on the mental health, so that we provide the player, first of all, with clinical findings, but most importantly, with some advice how to transition better from his or her sport. And obviously, there is a follow-up to this guidance, and there is also the possibility to have a referral for clinical psychologists for those in need, or perhaps for another professional, depending on the clinical findings. So it's how we approach that at FIFPro, just because we rely on the needs of the player, and this need was definitely clear from them since many years that there was something negative occurring at the end of the career, regardless whether you have been successful or not in your sport. And I think this is true not only in football, but also across all elite sport. It's something quite similar, I must say.
Yeah, and what are then, probably the obvious, those factors that make you suffer from these consequences?
Identity. I think a lack of identity outside of sport is obviously something that we see perhaps more often in football by contrast to other elite sport, where they tend to combine study and working better because of the financial aspect coming with professional football. So I think identity is perhaps one of the big key, but also not having a proper preparation during a career, not thinking ahead, not thinking about your second career post-retirement is definitely something that play a negative role and that can impact the mental health of the player. And there is also the physical aspect to that. We have seen from the scientific literature that those retired players affected by physical problems, especially cartilage degeneration, are likely to report mental health symptoms by comparison to those retired athletes who are perhaps free from any musculoskeletal pain post-sport. So there is also obvious relationship between physical and mental health post-career.
Yeah, and definitely also during career. Back to you, Nádia. Then maybe to ping pong this up and down. When you're injured, you already mentioned it, or for any other reasons you're unable to participate for a while, let's say pregnancy, for instance, that could also challenge your being as a football player. How do you deal with that? Are there any tips or tricks to secure that an injured player or a player who's out for any other reasons is still, maintaining that well-being, that mental well-being as good as possible? How do you deal with that?
Yeah, I'll probably focus my answer more on injury because most of the times pregnancy is planned on female athletes. They stop for a year and they plan to be outside of the court for because they want to be to raise a family. But an injury, you're not expecting for it to happen. You know that it can happen, but an athlete is never expecting to be injured. And I think it's the hardest time for an athlete to be injured because he sacrificed so much to be playing, and then he cannot play. And if we think about long injuries, maybe they are outside of the group, of the team, outside of the daily, the routine of the days. Maybe they don't take breakfast with the team, they don't travel with the team, they're not in the locker room with the team, they're not having a relationship with the coach. Often players that are injured are forgotten. They're just, okay, just recover, and then when you're okay, just come back to play. So socially, they are taken off their environment of the team. Identity, we are repeating ourselves here between me and Vincent and with the word identity, but it's really important to work on the identity of the player, not just post-career, but during the career. Because if you think about the daily routine of an athlete, a high-performance athlete, a professional footballer, maybe practices in the morning and then the rest of the day doesn't have much to do. And we are seeing an era of players that are high-performance athletes and they are sedentary also. So it's really weird, but they don't have much to do the rest of the day. Maybe they sleep in for all of the afternoon. Maybe they are seated just playing PlayStation or something. And sometimes they don't see themselves as people outside of the football context. So that has to be worked, even if they are reaching a lot of results in football. They have to be people outside of football also, because they actually are. They are sons and daughters and husbands and friends, and they can have another skills to show to society. They can participate in their community. I don't know, maybe prepare themselves for the future. As Vincent was saying, they will feel more secure of themselves. They would feel that, okay, an injury is always bad, that let's not make it romantic. It's an injury is bad, but you can learn from it and you can do other things, and you don't stop being an athlete because you're injured. You can also practice other stuff. Now your goal is to recover from the injury, and maybe you can perfect some other things that you don't have time to perfect when you're playing. So you have a lot of things that you can do. And you really have to look at an injury as grieving. You have a first moment of, you have to cry, you have to be sad. It's healthy to feel it, to think about it, to be angry, okay? But then you have to go up the steps. You cannot be angry forever. And I think talking again about resources, sometimes you have one sports psychologist for, I don't know how much players, and when they're injured, as I was saying, they are forgotten. Also, the psychologist also forgets them. Okay, and I think it's good to have you having interventions, even if you space them out a little bit more. But having interventions with this player, evaluate this player. I don't know. You can see. When he's returning, the phase of returning to play, sometimes you have some players that are afraid of the contact, that are not confident yet. Their self-esteem is a little bit shaken because of identity stuff. The relationship between the players, the confidence is shaken up also with the. Sometimes they have visual, spatial problems to, how do I say this? Sometimes you are so in between the game when you're playing, and then you get injured, and let's imagine an ACL and you're out for 8 months. When you go back to training, you have some visual spacing problems to put yourself on your positioning, or some stuff that were automatic, they're not as much right now. And sometimes you think, and I used to be an athlete, I also suffered from an ACL injury, and our mind is like, okay, when the doctor says that I'm ready, I'm going to be exactly the same as I was the second before I was injured. And that's a lie. No one tells me that.
Going on that a bit, Nádia, you know that there's medical professionals on this call listening in. They have to deal with these players, and I had an injury recently, and it disallowed me to do any physical activity. Now I'm not an elite football player, but I was already frustrated that I couldn't do anything. And my wife is a physio, and she was even more frustrated that I wanted to do a lot of things. So I imagine that these frustrations between players and also medical staff are quite common. What are maybe some potential guiding rules you can give to medical staff to deal with those issues?
I think the most important thing is from the beginning to show the recovering plan to the player. For him to be expecting, like, this is going to take some time, you are going to be, for some time, you cannot walk, you cannot bend your leg, you cannot do this, and then you're going to do this, maybe you take 3 weeks, maybe 4, maybe this, maybe that. So just being open with the player is really important to build that confidence between the medical department and the player, and for himself being more ready for the things that he cannot control in the injury, because there are some things that we cannot control in the injury, in the time of the injury, in the steps that you have to recover from an injury. So it's really important to be really clear and honest with a player. Look, this is bad, but we're going to do this and try this. Maybe this is going to work. We expect it work. Maybe not. If it doesn't work, maybe we can go this way. So it's really important for that clarity of the plan of the recovery with the player. I think it's the most important thing. And then sometimes I'll talk with medical staff and say, work on your communication skills, empathy skills, relationship skills, so you can deal with the frustration of the player, maybe the bad mood of a player, maybe he's not motivated for the task because he was motivated to score goals and to this and that, and now we just have to jump to learn how to jump again on his leg that doesn't work as he's used to. So sometimes we really need to work on our skills to deal with people. We are always dealing with people.
Empathy might be a word here to use to summarize that. Yeah. And we have a question here, and I think half of this was answered already, but I'm going to still throw it at you, Vincent, but maybe more from the FIFPro side. Are there any resources available at FIFPro that could support players and maybe also the staff to support their players in these challenges? I think you answered it partly already, but
I already mentioned after a football career consultation, when I'm focusing a bit more on mental health, we did develop in 2018, 2019, based obviously on the needs of the player and empirical evidence from medical science. We did develop a mental health toolkit that was based on 2 parts. First of all, a self-awareness video providing players with some basic information so that they could reflect on their own place on that spectrum, as Nádia explained. And the second part was more kind of game in order to develop resilience skills and how to act when one is experiencing mental health symptoms, but also, most importantly, when one player is observing mental health challenge among a teammate, to become more empathetical, I think it's a good word in English, or to be more resilient. So there are a couple of tools that has been developed. It has been documented in the scientific literature. So those who are online, who are interested about the content and also the feasibility and the effect of those resources, it has been published in the past years.
Wonderful, wonderful. And while you just said that, Vincent, we are looking for the links to those resources to put them in the chat for those who are listening today. We are talking about players here mostly, but of course there's also medical staff, other staff involved in professional football. They might also suffer from some adverse mental health aspects while doing so, because you're still exposed to a high risk environment. Can you say something about that, Vincent, in your experience, how that deals?
Yes, as already mentioned before, we have had a focus especially on elite athlete or professional footballer in our case, but elite athlete in general, and it has been shifting towards the coach and shifting even further towards the medical team. I think there was a survey that was published in 2 manuscripts on the British Journal of Sport Medicine among medical professionals that took care of the Paralympic athletes at Tokyo and I think Beijing or something like that, recent Paralympic game. And this survey showed that 1 out of 3 medical professionals reported some burnout problem during the game, while more than 1 out of 10 had some depressive symptoms, and even worse, 8% reported some idea of suicide. So that was very severe, very dramatic findings, I must say. And it's why, as you mentioned, we need to take care of the medical professional as well. And it is even more logical, because if we want to take care of the players' mental health, and we need to make sure that those who are taking care of them are also in a good place, not struggling with their mental health. So we need to have an holistic approach and to look at the performance, medical staff and players as a whole.
And Nádia, can you describe that from your experience with the Portuguese FA, and what support do you have for medical staff and maybe other staff personnel as well?
Not just in the Portuguese FA, but I think all around sports we have this phenomenon of we all live in a high performance environment, but only the players feel that they have to sleep right, eat right, and exercise to perform, and that's a lie. We all have to sleep right, eat right, and to exercise to perform at our best. And sometimes we have high demandings on high performance environments. We do as a medical staff, as coaches, as other staff. We also have traveling. We also have long hours. We also don't have sometimes a day off, and we don't take care of ourselves. And that reflects on the way that we work with our players. So also the performance of the players can be impacted with our mental health being on spot or not, because our focus will not be the same, our concentration, our mood. I was just talking about relationships and being empathic. If you don't sleep right, eat right, and exercise, your mood, your relationships are not going to be the same. You're not going to have your emotional tank, as I said, full to be available to others. You're just going to be saving your energy to survive if you're not okay. So you do have to have your social life, your family, your physical right, your cognition right. You have to hydrate yourself. Also, that has a direct impact on your performance as a medical staff and on your work with athletes.
And it's in my thoughts a bit of a vicious circle if you explain it like this, because if you don't take care well of your physical health, your mental health goes down. If your mental health goes down, you take less care of your physical health. So getting out of that spiral down, it's very difficult. What would you, probably the answer would be it depends, but what would be your main target? Increasing that physical health so mental health follows, or making sure you break that mental health spiral so the physical health will follow? Or is it just a bit of both?
I think it's a bit of both, but you have to start with the thing that it's easiest to the person that you have in front of you. If it's easiest for you to start with physical activity, just start with that. And start slow. If it's easier for you to just start to be a little bit more social, to recharge your battery with your people that you like, just start with that. Just start with it's easier and start with small step, because we have the habit of starting really big. Like 1st of January is coming, everyone has resolutions, everyone is going to start to read every day and to eat greens every day and exercising every day. That doesn't work, and we know it. In February, we just gave up on half of the things that we said we were going to do on the January 1st. So just start small. You have to feel competent and capable of doing your next step. And then you do another and another and another. This is really important to do in clubs, like moments of psychoeducation with the staff, like moments of workshops or lectures with the staff. So they feel that they are part of it also, and also to give them small strategies to go throughout the day, because they are also high performance athletes, but in another area. We have to take care of them too.
Yeah, and that's exactly, I think, also what Karolakin you just said in the chat, right? We're part of a team, and the investment should be in all aspects of that team, and of course players, but there's a lot of other aspects to that team as well. So, very thoughtful. Thank you. Maybe given time also towards the last questions, one for you, Vincent. Is there anything from your work at FIFPro that you think we should still highlight on this topic that we haven't touched upon yet?
Well, I mean, it has been noted in a previous remark that you mentioned indirectly, because FIFPro is representing a player via our national union. So we echo the voice of player. But when it comes to my role at FIFPro, striving to promote and protect the health of the player, both during and after the career, I'm focusing perhaps majorly, or in the large part of my work, to facilitate the work of the medical team, I must say, because I know that all medical professionals who are working in the professional football industry have the same goals than we have, namely to keep the player in a good place, that they stay healthy, safe, so that they perform optimally. So I also want to provide medical team with some optimal regulation, optimal guidance, better policies, so that they can do their work even better tomorrow than what they did yesterday. So actually, I'm working a lot towards the working condition of the medical professional, because I trust them for the work they do for the players.
That's good to know. But does that then also mean that medical professionals struggling with these issues are able to reach out to FIFPro to get some answers, or not yet? Well, you're working on it.
Of course, I'm open to answer any queries, but obviously mainly we focus on the player, but indirectly, because of the good collaboration, as mentioned by Zoran at the start of this meeting, the collaboration between UEFA and FIFPro, for instance, and we joined forces in order to develop better protocol, to initiate, this kind of webinar and all this kind of educational materials that has been developed in the past. It's something that is obviously of added value for the medical professional within the professional industry, and subsequently it is beneficial for player.
More to follow. Great. Thank you. Nádia, final question to you. You've been an athlete yourself. You just mentioned it. You had an ACL injury. You've worked in club football and national association. Can you share maybe some key lift experiences that the listeners on this webinar could learn from, maybe?
Yes, I think it's a little bit of what I talked about today, a little chunks of what I've talked about today. I was a good player, but when I got injured, it's like I wasn't ready for it, or when I stopped playing because of an injury, I was already studying for being a psychologist. And I went 4 years to start working as a psychologist because I didn't feel I was a psychologist. It was, again, identity matter, because I felt I was a basketball player. I didn't felt I was a sports psychologist. So I think mental skills training has to be one of the next steps of professional sport. We do it with physical training, we do technical training, we have scouts, we have analysis, we have technical individual trainers. We need to give this step, to make this step on the mental health, mental well-being, and mental skills matter. Because I felt as an athlete and as a sports psychologist and working with coaches and with players, with coordinators, with directors, with the organization, that I think that it's another step that we have to make. We have to think about clubs as organizations, because we cannot work a culture of a team if the organization doesn't have that culture. So it is all embedded in everything. But I think we have to have that step of preparing people for a step back, for a contract that is finishing, for an injury, for a life event, for a step on their career, because good things also are stressful factors. And for the end of the career, because we know since the beginning that the life of an athlete is short. As an athlete, we say that an athlete has 2 lives, and we all only prepare them for one life, and for that life to go 100% okay. So we have to prepare them for everything, and everything is everything that we can. So I think that's the biggest lesson that I had. You need to be ready not just to play and play good. You need to be ready to have a bad day inside the pitch. You need to be ready to not play, for an injury, for a life event, and for the after career also.
You need to be ready for a lot of things.
Yeah.
And it's our mutual job to prepare the players to be ready for all these things, while being ready ourselves as well. I think that is maybe really, really brief a summary of what we've discussed, but I think a very inspiring hour altogether. So thank you very much, Nádia, and thank you very much, Vincent, for your time and sharing your thoughts. Probably not the last time we're going to talk about this, but for now, I would like to thank you very much and wish you a very, very nice evening.
Thank you.
Thank you very much. See you next time.
See you next time. So in the last minute, again, thank you all for joining tonight. I saw there was 1 or 2 more comments in the chat about some resources. We shared the resources that were mentioned during this hour and the links of that in the comments box as well. So if you can't find your answers there, please reach out to us, and we try to be more specific in our links and in our directions. Before you log off, may I once again plug our medical symposium in Lugano in February 2025, 4 to 6 of February 2025. Maybe I'm a bit biased, but I think a great meeting and a great symposium for a reasonable price. So please tune in there, and maybe we can chat live and in person more about these topics that we've discussed so far in the webinars. So for now, without any further ado, I think I'm going to wish you all a good evening or night or morning, wherever you are in the world, and see you next time. And next time is December 16th, just before Christmas. And we're going to talk with the Football Research Group, with Marcus Walden and with Luca Stefanini from Juventus, about the club injury studies and how they have learned us more about the injuries out there, what we can do about them, and how they improved our medical care for the football players. So tune in for that one, mark your calendars, and hopefully see you then. Cheers, bye-bye.